But let's move on to some other issues. 115,000 jobs lost within the COVID period. These, among others, are some big findings the Ghana Statistical Service has been revealing in its recent surveys. Roland Walker has been interacting with government statistician Professor Samuel Annim. That conversation comes right now.
COVID-19 has had serious impact not only in Ghana but also elsewhere around the world. Now, there's every indication that data is very important in the way that we plan. And the foremost institution that is in charge of collecting data is the Statistical Service of Ghana. Now, the Ghana Statistical Service has been doing a number of actions, collecting data in what it calls waves of trackers. Now, these trackers are being published, and it is indicative for all of us to know that over 85,000 family or household businesses have since closed down, not recovered or reopened, even post-lockdown restrictive periods. What does it mean? That is why we're here to speak to the government statistician today. So we want to speak to the government statistician. Professor Annim has great experience in his field, and it's for this reason, that's why he was definitely appointed. Of course, for a man who looks at numbers, has his people deployed to the field to do some great analysis. Well, the analysis done by the Ghana Statistical Service, especially within this period of coronavirus and its effects on the economy and various subsectors, will become very topical when we're having the discussion. I have to say good morning to you, sir.
Good morning, Roland.
And nice having you. The last time you were in my studio, you had promised that we'll have the census.
Indeed.
Right. You've thrown the timeline away.
I wouldn't say we've thrown the timeline away. With certainty, Ghana would not miss out on the 2020 round of population and housing census. We are yet to make a determination on the date because it has to take into consideration quite a number of factors. And as you know, we have the National Steering Committee for the Census, which is chaired by the Minister for Finance. So we're hoping to have our next meeting next week and a determination will be made. But we needed to postpone it as the pandemic evolved, and also because we had quite a number of national events, i.e. the voters registration exercise coming up, and also the fact that the census operations would have to be done during a period that the country is relatively stable in terms of minimal movement. So taking into consideration all the national programs that have been earmarked for the rest of the year, our proposal is we make a consideration for sometime early next year for the census.
How badly has coronavirus affected the various subsectors of our economy?
For now, we need to look at it from different perspectives. I would hesitate in giving a summary response to that because, as you know, GSS has rolled out 3 different trackers: the household, the business, and the local economy tracker. And within each of these trackers, you need to think about the dimensions or pathways that firms, businesses have been affected and households have also been affected. So once we get into the details and we start picking on them, I'll show you how the different sectors have responded to COVID-19.
I'm just going through your business tracker that was just released, and it gave me an insight into the number of jobs that had been lost. But more so even the numbers, in excess of over 700,000 people who are employed but have had to get truncations or cuts in wages. Very excessive.
So you'd appreciate this better if you look at it from the perspective of businesses that had to close down as a result of COVID-19. So from our tracker, we asked businesses whether they've closed down temporarily or they've closed down permanently. And from the survey, we realized that 33,000 businesses had to close down during the partial lockdown period. And also this number affected different sizes of businesses moving forward. If you put together the proportion or the numbers for that matter that closed down temporarily and those that closed down permanently, we are talking about 85,000 businesses that are still closed down. As we speak, we have 85,000 businesses that have still closed down. So over the period of the lockdown and post the lockdown period, we've had about 115 businesses that have closed down. So this is what is culminating into the effect of the number of workers within these businesses that have had to have had a cut in their pay.
And that definitely would mean that some sectors will be more affected than the others. The last time I was having some conversation with the TUC, they were very particular, very poignant, and saying that the hospitality industry seemed to be the most affected. Is that what you found also in your survey? Indeed,
that is what we found out, and the accommodation and food subsector, because of the hypothesis that they were going to be the most hit by the pandemic, we isolated that subsector, and they experienced a 57% dip in their sales. And also from the perspective of workers that had to be laid off and those that had a cut in their wages, it was still the accommodation and food subsector that was hit the hardest.
There was an interesting point about how some of these businesses perhaps could have diversified. Did we try to take a look at whether these shareholders or those who were running these businesses had that in mind?
Yes, I mean, it wasn't to the extent that we were expecting, because from the survey we realized that just about 1 in every 10 businesses adopted the use of technology, and even for that matter, mobile money transactions, to minimize the effect of the social distancing, the physical distancing on their operations. And one was expecting that a greater number of businesses would have gone digital so that they could still go on with their services. And this is one area moving forward we think policymakers should emphasize in terms of how do you make computers and internet services available to businesses at a certain affordable cost, so that they can diversify as we have to now deal with the pandemic.
I know that it's very important for us to take a look at it from services, but also that those who always were pegging what their output or returns were in financial quantum. But I was a bit surprised when within the period per what you release, there was indication that education institutions were also mostly affected by closures. And I'm thinking many educational institutions were mainly not for-profit institutions, so to speak.
I mean, you need to look at it from the perspective of the output of the business. So if you are interested in the employment of the business, then definitely the educational sector is employing people. And for the sake of COVID-19 and the closures of the schools, people working in the educational sector have had to stay at home because of the closures on the school. So it depends on the variable that you are using to measure the performance of a particular business. In this particular instance, we use 2 variables, which is the sales and the employment. So the effect of business closures on education from an employment perspective was clear.
On the ground, you get to find that for those that lost their jobs within the period of the lockdown, partial lockdown, have not been able to redeem their jobs back, even though the services or the sectors that they worked in seem to have resumed either fully or partially. And there's this finding. It said 41,952,000 workers lost their jobs during the partial lockdown. So my question is, we're going to have many of these people not returning back to work, but it's because the business owners have to take business decisions. Is that what you found out of anything?
So essentially these people, that is the 41,952, have been laid off as a result of COVID-19. And that is why we have decided to follow this same cohort of businesses for at least 3 times before the year runs out, to really see what is going to happen, given that interventions are being put in place. Once the president of the government, for that matter, has decided to inject 600 million Ghana cedi stimulus to ensure that businesses stay in business, it's important to see whether these interventions would enable some businesses that had to lay off workers to have some packages for them as they start their operations. But indeed, if the businesses that have permanently closed down, and for that matter, do not come back, and you find yourself with one of these businesses, then it means you'd have to deal with the unemployment that you find yourself in.
Now, this is just one aspect of the three type of actions and activities you decided to undertake. The one that really looked at I would call it the human index aspect in terms of jobs, health access, educational, and all that, effect on household incomes. If you look at the section on health and the indication that we had people who needed to access health services. Either maybe they have new infants, would have to get access to immunization services, etc., but were afraid to get access. It means something went wrong. What may have gotten wrong there?
I think it's the dimension of COVID-19 that we all should appreciate how households or even institutions were responding to it. And as I indicated, it comes with a lot of uncertainty because nobody knows when it's going to abate. Nobody knows the different dimensions that it's going to take. So indeed, we had 35% of children that missed out on their vaccination. And when we probed to find out why they missed out on their vaccination, that is about 3 in every 10 children, we had 3 responses in relation to COVID-19. The category that said that I wouldn't go because if I go, I'm going to be infected. And this is something from the household, the parent point of view. So this is more or less a self-exclusion from vaccination.
And that's one point.
That is one point. The other point is when we had the health facilities closing down for some of these. So the health facilities excluded parents, children for coming for vaccination. And the third category are those that were unable to go because of the restrictions on mobility. Once there were some restrictions on transportation, fares had gone up and so on and so forth, it also excluded some parents from taking their children for vaccination.
But maybe we could have done something, either at the community level or the state level, try to draw them into giving them a number of behavioral change communication actions.
So this is exactly what we are trying to get from our third tracker, which is the local economy tracker. So the first 2 has dealt with the government and the people, the government and businesses. But moving forward, we should begin to think about, as you rightly said, how communities that have different experiences with how COVID-19 is evolving would prepare themselves to cope with the pandemic, but more importantly, how they're going to be resilient moving forward. Because we should all know that different economies, local economies, do not have the same strength, the same opportunities. So there should be that consciousness on the part of local community leaders on how they can deal with their peculiarities as far as COVID-19 ramification is concerned.
So when I was going through all these tracker reports, survey reports that we were bringing, one thing was on my mind. It looked like as a country we're not ready for anything pandemic. On the scale that we've witnessed this. Of course, we can say that no country has ever been.
Again, as a statistician, I would be hesitant in making statements like we are not ready. But as I said earlier on, clearly the pandemic, although globally, has brought about or has exposed our lack of knowledge. Some other countries had buffers than others. So if we're thinking about the number of ventilators that we have, if we do a comparison across different countries, you'll find where we find ourselves as a country. And given that we had to go in to think about what health facilities we need to get, so we have more or less gone by this in a very reactionary way rather than the ideal way of being proactive about it.
How many households did you sample in the first tracker?
In the first tracker, we targeted close to 5,000 households, but we ended up with 3,256 households.
When you undertook this sort of investigation, or let's say collecting data, so to speak, what was the one thing that struck you about inaccess, inequality in relation to the various human index of variables?
So essentially, we looked at this from the human development point of view. That was the key driver. And once you talk about the human development index, you're thinking about the education, the standard of living, and issues related to health. That is why our first tracker focused on these three areas. And what we realized from my point of view is how this is impacting on children from diverse perspectives. So it wasn't only the issue of vaccination that hits me, but the issue of how children are now living with their parents in their respective homes and the challenges that are coming with it. And also from the educational side, the fact that close to 35% of JHS and primary pupils had not engaged in any form of learning during this period of lockdown. And the question that I ask myself as an academic is, can we really have interventions that will sort of bridge the gap that is going to happen when we return to normalcy? Because you're going to have this 35% of children that would not have done anything for the past 6 months, for the past 8 months, and they're going to sit in class with their colleagues who would have had access to either self-tutoring or some parents doing tutoring or an external person doing tutoring. Within the schools, would we have programs for catch-ups? So we really need to do a profiling on the diversity of impact at different levels as we think about the recovery pathways.
Now this 35% across the demographics countrywide, where are they dotted?
I have not paid particular attention to that. It's something that, as I indicated during the release, we said this is the first edition, and we foresee at least doing releases every other week. And we're going to have one of the releases that is going to focus strictly on children from different perspectives. And we would be able to tell you the geographical distribution of these 35%.
Because I ask this question because, one, I'm a parent. And I also do know that the other means of complementary education that we have experienced for our children, indeed even for adults in tertiary institutions over the last 3-4 months, has been using the internet. And the internet is not broadly deployed across our country. And so definitely that will influence that 35% that don't have the access.
Yes, I do agree with you that there are some macro factors, as you rightly said, that would influence the non-use of internet services. But still within the domain of responses from households and individuals, there could have been that consciousness to see how we can mitigate that macro effect of not having internet services broadly deployed over the country. For me, the main question is, of the 35%, were the parents aware that they had to do something like that? Yes, when we probed, they said, or the responses that we got were related to computers and lack of internet access. But if that is a macro level challenge within the household, what attempts are you making? Especially when you know that they are going to go back and sit with this 65% that have internet access on computers.
There's the wider aspect of access that perhaps maybe as a people we haven't talked about. That is having the systems in place post-COVID. Is there something statistically we can do to make sure that we evenly try to bridge the gap or spread access, knowing that within COVID, these were the gaps that we noticed?
So let me proceed by saying that it's important we give a broader definition to access, because it's sometimes confusing, because access could be looked at a minimum of 3 or 4 different levels. I mean, the basic one that we think about is whether the facility is available and whether the facility is affordable. Then we are quick in saying that if it's availability, should it be provided by the public sector or the private sector? And if it's affordable, it's an issue related to affordability, then is the cost related to it. But within this is the scope of issues related to convenience and issues related to flexibility of getting access to the particular service. And this is where we need to begin to think about, yes, we can make it available, but getting it goes through some challenges and makes it very inconveniencing for households to get access to them. So moving forward, and as we do at Ghana Statistical Service during censuses, we ask a number of questions related to services and try to get a sense of one, the distance or the time that it takes in accessing the facility, and whether it's within a certain permissible geographical area that would lead to convenience and that will lead to flexibility. The other thing is quite a number of services facilities are sort of snapshot, in the sense that they come in at a particular point in time and the next minute when you need it is not available. And that is an element of continuity that we need to think about when it comes to accessibility. So access, as I indicated during the release, moving forward, we're going to emphasize on the quality of access, where we're going to touch on issues related to convenience, continuity, and flexibility to get a better understanding of what we mean by access.
Nationally, more than 3/4, that comprising of some 77.4% of households, they did report that the total household income had reduced since March 16, 2020. And 3.1% also reported an increase in their income. And so that's very pale compared to the 77%. This that you picked from the population, did they give you an indication as to who is poor and who is not poor?
Yes.
Who falls within the certain brackets?
Moving forward, we're going to estimate the proportion of poor people and the non-poor people in our subsequent waves. But Roland, thank you for bringing this issue up, because we need to have clarity on the reporting on the total number of people or households that were affected by pay cuts. So as you rightly mentioned, 77% of households reported that they experienced a reduction in their pay. Then we extrapolated to the population in terms of persons. Then we said, of the 77% of households, using an average household size of 4 persons per house, it translates into 22 million persons who will be affected by the reduction in pay. It is not 22 million people who experienced a reduction in pay. So what that means is that if in my household I have a pay cut and I have a 5-member household, all the 5 of us in the household would be affected by the pay cut. But indeed, it's only one person who has experienced a pay cut. So 22 million will be affected by a reduction in pay cut, not 22 million people who experienced a pay cut, but they live in households that has at least one person that has experienced a pay cut. So in terms of how this will translate into the measurement of poor and non-poor persons, this is exactly what we are going to do in our subsequent waves. We are not doing it this time because the effect of COVID-19 has brought about anxiety in terms of spending, reprioritizing one scale of preference, and so on. So if you do this in the second wave and in the third wave, we'll be able to see those that are now poor simply because of the shock associated with COVID-19, and those that would move up the poverty line when they get the right interventions or when they find means of accommodating with the challenges with COVID-19. I must indicate that on the heels of the release of the household job tracker, we had released the multidimensional poor index, which also was revealing to a very large extent because it was our maiden multidimensional poverty report. And prior to that, we had focused on the consumption expenditure, the money metric approach in measuring poverty. And moving forward, we feel that this is what gives policymakers a direct tool to work with, because now we are able to tell you that this is what is happening in the area of nutrition, this is what is happening in the area of school attendance, this is what is happening in the area of sanitation.
Now, prior to COVID, what was the situation like in relation to the haves and haves not?
So there are two things. I mean, the situation was that we had 23.4% of our population who were poor, that is using the upper poverty line as the cutoff. And the other side, in terms of the haves and not haves, is the issue of inequality in Ghana consistently being on ascendancy. So since we started rolling out the Living Standard Survey in the late 80s, we've seen our inequality figures, that is the Gini coefficient, hovering around 0.4, 0.41, and 0.42. So the increases are not that significant, but we've not been able to address inequality fully.
And I was reading a literature the other day, and it did indicate that we're going to have a sizable number of the demographics of the population in developing countries, and particularly there was a mention of Africa, who are going to see categories of their population moving into extreme poverty levels. That also should include Ghana. Whilst you don't want to conjecture, of course.
Yes. I wouldn't be that pessimistic and say that it would include Ghana, but I'll be quick to say that if we are not circumspect about how we want to contain COVID-19, it might end up that way. So the issue really is how to contain it. And when I talk about containment, emphasis is on whether there are recovery programs or not, but more importantly, how these recovery programs are rolled out in terms of targeting. If we have, for instance, the stimulus and it ends up in businesses or with businesses that do not really need the interventions, it will not yield the needed results.
And that's Roland Walker's conversation with government statistician Professor Samuel Kovna Annim, right there for you here on the show. And that's your talk. Stay with us. We will go roving with Nancy Emefa Jiradosi. She's visiting Awoshi. Remember yesterday there was a demonstration because of faulty traffic lights. How does it look the morning after? We'll be back after this.